Hey guys, it's Dr. Hub. Whether you're in medicine, from specialty to super specialty, allied sciences, or simply curious, this focus content it delivers the key points you need to know. Now we look at the physiological changes. So the thing is physiological changes in terms of the aging. So first will be the general changes. So what are the general changes? The general changes will be including decrease in the BMR. Next it can also include decrease in the lean body mass, as well as there will be an increase in the adiposity. So this decrease in BMR, decrease in lean body mass and increase in adiposity. Next we will look into the skin changes. So what is happening in terms of the skin? So in terms of the skin there will be thinning. So this thinning of the epidermis and also the dermis. So thinning of the epidermis and the dermis, and this is due to the increase in the elastin, as well as the collagen. Next will be the melanocytes. So decrease in elastin and the collagen melanocytes, and this will lead to the decrease in photoprotection. So this decrease in photoprotection. Next will be we are talking about the net effect. So what will come as a net effect? Net effect is nothing but there is wrinkling of the skin. So to recap, we saw the changes in the skin. There was thinning in terms of the epidermis and the dermis. This increase in elastin as well as collagen. In terms of melanocytes, there will be decrease in photoprotection, and the net effect is it includes the wrinkling of the skin. Next, we look at the active metabolites, the active melanocytes. Active melanocytes in the hair follicles. The active metabolites in the melanocytes in the hair follicles, they result in the graying of hair. So active melanocytes in hair follicles will result in graying of hair, and there is also the nail growth which is same. Next we move on to the skeletal muscles. So under the skeletal muscles it includes a steady, there will be steady decrease in the skeletal muscles and muscle mass. So the steady decrease in the skeletal muscle mass. So this is nothing but the sarcopenia. Then when you look at the bone, there is bone resorption. So the bone resorption it exceeds the formation. So the bone resorption exceeds formation, and this leads to bone loss, and ultimately it can lead to osteoporosis. Next we move on to the synovial joint. So in synovial joint there will be thinning and altered mechanical features. Thinning and altered mechanical features, and this is of articular cartilage. So thinning and altered mechanical features of articular cartilage, and this will lead to osteoarthritis. Next, we move on to the CNS. That is the central nervous system. So let's look at sensory. So sensory, it deteriorates with age. Sensory deteriorates with age. Next, there is also hearing loss. The hearing loss is particularly for the high frequency. Next, looking at the vision. The vision, it deteriorates due to the presbyopia. So deteriorates, and this is mainly due to the presbyopia. Next will be cataract. Next will be glaucoma, as well as the macular degeneration. Next will be the reduction in the taste. So there is reduction in the taste as well as the olfactory sensation. Now moving on to motor. Under motor, there is a showing of reaction. And so showing of reaction time. There is a time between the stimulus and the motor response. So time between stimulus and the motor response, and slowing of the central processing. So slowing of the central processing. Next, there is also the cognitive functions which decline. So to recap, the reduction in the taste and olfactory sensation. Under motor, it shows the reaction time. There is a time between the stimulus and the motor response. Then there is slowing of the central processing, and cognitive function, it can decline.